Hey, it's Mike Vanderpool here with Northwest State Community College. I am joined by Dr. Thompson, our president at the college, and we want to talk today about the opioid event that we're having on campus here in April. I'm interested specifically because my hometown has had huge problems with opioids. It's impacted friends and family, so I think most everybody we've talked to has had some minimal degree of separation that's impacting their lives. I think it's cool that we're doing this event on campus. You hear the word Harvard involved with anything, your ears perk up a little bit. So I'm kind of curious to figure out how this event came to be at NSCC of all places.
Okay, so the serendipity of events is how the world works. That's the way I kind of look at it. And I received a call from Bryan Community Hospital saying, we have this interesting conversation with Harvard Medical School. And the bottom line of the conversation is that an anonymous donor from Mount Pillier gave money to Harvard Medical School to put on a best practices event to help make a difference in Northwest Ohio. And Bryant Hospital thought that Northwest would be a great spot to host it because of our central location and facilities. So that started a three conversation of the hospital, the school, and then Kathy Finn at Harvard Medical School. So we started talking, made a proposal to the donor about what to do. The donor was very impressed by that and said, go forward. So that got the ball rolling at the beginning. So I think the key thing that I would say, Baldwin Wallace just did a statewide study in Ohio, and 1 out of every 5 families is directly connected to the opioid crisis. So it has both direct and indirect people that are connected to that crisis. So by number, it is the largest impacting activity in Ohio. When you look at it that way. And so we understand our responsibility to provide a place for people to gather and talk about it and do something about it. So that's how we got started.
Interesting. So then what are the details with regards to what's happening and when?
So there are 3 core events attached to we're calling it Dealing with the Opioid Crisis. And on Friday evening at 6 o'clock, we're having an open to the public event in our large atrium where we're going to show a highly respected documentary that has been at several film festivals called The Providers. And The Providers is about a couple of doctors or medical professionals that have been working in a program, a federal program called the ECHO program, which is a case management way to help people through opioid addiction. And it's shot in northern New Mexico, where they have the highest death per 1,000 by heroin addiction, amongst others. So the producer of that movie and a couple of the actual healthcare providers are coming here. So we're going to show it, blacken out the atrium, make it a theater type event, and we're going to show it. It's about 90 minutes long, and then we're going to have a Q&A with the community afterwards with the very doctors who you see in the movie. And it's a very, very strong documentary. So
is that going to be then open to the public? How will people buy ticket or get tickets?
It is open to the public. It will be at 6 o'clock on Friday night, April 12th. And there is a registration site in Eventbrite we're asking people to register to, so we have an idea. There'll be a little bit of food at the end, kind of reception food. So we're asking for that, and probably as I talk, magic will appear and a site will come up to tell people where to register.
Yes.
So that's the Friday evening. The Saturday morning, back again early in the morning, Harvard Medical School is flying in a group of their faculty who have been studying best practices on what communities can do, specifically rural communities can do, to help with the opioid crisis. And that is a certified continuing medical education, CME event, that Harvard has certified for doctors and nurses and addiction specialists. So that, again, has a website that people have to sign up for to get the activity. And they have multiple 4 sessions where they go through different topics. And people in this area that are on the front line can learn the best practices that are out there to help people. And the third event, and the one that we're really encouraging people that are interested in opioid addiction, maybe they've had a family member that's been touched by it, or they're one of the key stakeholders in the area. We're going to have a community panel at 1 o'clock on Saturday in our Voinovich Auditorium, Building E. And the purpose of the panel is to hear from frontline people in this area what's working and not working right now. And then the group is going to vote electronically on the 2 or 3 things that we can do in this area to help improve what we're doing in opioid addiction. What I've discovered is we have a lot of wonderful people doing great things. And we've asked and invited an ER doctor, somebody from the Adams Board, somebody from the health department, and somebody from a local employer that has an HR person who helps people with addiction. So we'll put a group together, and then the room, who's always the smartest, right? The room's always smarter than the individual. The room will then think through and go, well, maybe these 1 or 2 things would be the best way for us to go forward. So we're not looking to try to run anything, but more just connect people together.
Facilitate some of the collaboration.
Yeah.
Because that's one of the things I've noticed too with some of the research I've done into the space is that there's a whole bunch of people doing cool stuff, but they're doing it sometimes on islands.
Right.
And so this sounds like a place where we're bringing them together to bounce those cool ideas off each other. Maybe let some people know that they exist.
Correct. And there is a Opioid Addiction Council that has several high-quality people on it. So the point would be Recover Ohio, for example, is coming up, and it's one of the governor's top, was one of his first executive orders, was create Recover Ohio. So we've personally invited them to attend and give us a statewide overview of the resources that are available. So we fully expect that we're going to have follow-up training for specific audiences to help this area to come out of this. The point of that stakeholder meeting is what can we do that will make a difference here in Northwest Ohio.
Awesome.
Yeah.
Awesome. Anything else that you want to share? I mean, I feel like, I know more about what's going on now than I did 10 minutes ago. So,
well, it's the serendipity of how the world works is you get to know people, you're involved in the community. So this is all an extension of Northwest, just being out there and talking to people on a regular basis, and then getting a call that says, well, I've got this something, and wouldn't it be great if you would help with it? And so we're jumping in with both feet, lots of people. Harvard, it's quite the combination. Harvard is providing the subject matter expertise on best practice in rural areas. Bryan Community Hospital has a lot of the medical professionals and the contacts to many of the key addiction services that are connected to it. And then Northwest is a host, and obviously we're connected to mayors and Kiwanis and Rotaries and other civic groups. So together, we can do something pretty cool. Awesome. Like finding a great documentary that's been highly received and then bringing it here as kind of a premiere movie type event. So it amazes me what good people can do when you partner together in new and unique ways.
Awesome.
Yeah.
Great. Thank you for your time. Anybody wants to find out any more information, any of the links we talked about, we'll make sure that they're somewhat adjacent to this video wherever this video ends up.
Good.
And any questions, I guess reach out and we'll do our best to answer them.
Yep, we will. Thank you.
Take care.